My name is Holly Dillon. I'm a board certified and licensed behavior analyst. I'm the senior manager at our Children's Center for Autism in Rosenberg. Always consult with your medical professional, so if that's your pediatrician or your healthcare provider, because they can refer you. For example, in the Children's Center for Autism, we are working in those areas of communication, social skills, working on some repetitive and restrictive patterns of behavior, but we're applying the science of behavior. So behavior analysis, there's a long history of effective research that really is helping people learn skills that they need to be happy and to be able to thrive in their environment. One, Texana Center is really well established in the community, and between their mission and their values, there's an emphasis on really helping a family or an individual get what they need. So it may be, I may get a call for somebody needing some behavioral health services, and maybe that's not my realm, but there's someone within Texana that I can get them to so they can get the help that they need. We like to talk about Texana as the gateway to services. So if you think you need services, contact Texana so we can get you in touch and get you some resources that you need. I think, when it comes to autism intervention, early intervention is really, really important. Sometimes people, they're worried, and as a parent, I understand, they're scared. They don't maybe want to label their child, so they're afraid to get a diagnosis. But even just a little bit of help sometimes is all a kid needs to get on track and get those skills that they need to be successful. The website is a good first step, but a lot of the time you're going to need more information. So people can always get a hold of our authority division and kind of check in with them, because they may need to do an intake and get a diagnostic evaluation. But for example, if they have an autism diagnosis, if they reach out to our CCAAdmissions email or any of those autism related programs that provide behavior analysis services, we're going to ask them the questions to help direct them to the program that's right for them. So for example, if it's a young child, maybe 2 years old without an autism diagnosis, it may be that they need ECI, or maybe we can help them get in for a diagnostic evaluation and get services through insurance, or we also have services that are for individuals with maybe higher needs, such as our Behavior Treatment and Training Center. So really just getting in touch with Texana is the first step, because we will try to get you to the right department or person. We work with children, and the therapy involves the child, but it also involves the whole family and the caregiver. And I think sometimes parents get lost in the shuffle when their children have high needs. And one wonderful thing about Texana is that they can get the services maybe that they need. Maybe a parent is struggling with some mental health issues and their child is also in services. Just don't forget about yourself as a parent and a caregiver and a spouse when you're trying to meet the needs of your child.